I told you that every single one of you, every single person working in social innovation was actually a public health practitioner? And that public health practitioners were some of the original social innovators. The discipline of public health, one that is over a century old, holds many valuable lessons for the rapidly evolving field of social innovation. And I'm here today to share a few. But first, some context. I went into public health for the same reason I imagine many of you are working in social innovation, because I wanted to positively influence the life course of large groups of people. I didn't want incremental change. I wanted social movement. Public health has always been a fascinating field to me for its power to affect massive social change, from incorporating iodine in table salt to prevent goiters, to incorporating fluoride in water to prevent dental caries, to taking on big tobacco and essentially making it uncool to smoke. Over decades, public health has evolved from focusing just on mass populations and getting rid of disease to now focusing on actively promoting health with a nuanced exploration of issues related to inequities and disparities between groups. This field excites me for its constant evolution and its amassing of so many multi-sectoral approaches. As I've recently entered the field of social innovation, I see many areas of overlap and many opportunities for the disciplines to merge. And so today, I'd like to bring a little bit of the public health mindset to all of you. What do you think of when you hear social innovation? Perhaps the words on this screen resonate with the work you all do. Call this social justice, equity, or just grand social challenges that need to be addressed. Think about your work. Can you draw your work to one of these words on the screen? In public health, we know these words and issues as social determinants of health. It was a big moment in public health when we discovered social determinants of health, because what it told us was what we thought was responsible for health, genetics, medical factors, was really only responsible for 20% of our health. Our external environment and context influences 80% of our health. For instance, my first big project in public health was to work on addressing the obesity epidemic. We had just learned of new evidence linking neighborhood design, where we live, to our health. As a public health practitioner, I had to immerse myself in the fields of urban planning, transportation, and land use in order to be able to address obesity. Our external context, social factors like housing and walkability, influence 80% of our health. And so this big, meaty concept that health can be about so much more can apply to any issue. That there is so much more to any issue than we may have originally imagined. And that all these words on the screen may be linked to something else entirely is why I think every single one of us is a public health practitioner. The field of public health began in the 1800s in London with the story of the Broad Street Pump and Dr. John Snow. The original Jon Snow, not the Game of Thrones version. The story goes like this. In the mid-1800s, Jon Snow was treating patients suffering from cholera in and around London, using every technique he had learned, but not the end in sight. His patients kept dying, and at the time, no one could figure out why the disease affected so many people. He was convinced that there was something actually spreading the disease, a novel concept at the time, and eventually connected it to water, and that every person who got sick got their water from the pump on Broad Street. He decided to break off the handle to the water pump and saw an immediate reduction in the outbreak. And for this, he's known as the grandfather of public health. Since then, public health has evolved in its approach. We're not breaking pumps anymore. And one of those areas of evolution most relevant to social innovation is in recognizing that health wasn't a condition that we fell victim to, but rather an outcome of something else, determinants. Let's take away the word health and apply this to social innovation. What happens when you think of poverty as an outcome or homelessness as an outcome rather than a condition? What happens is you start to create in your minds the space to think about what determined the outcome or led to that outcome. What were the influential factors? It forces us to cover more permanent solutions. This brings me to my first public health lesson for you all today. Move upstream. So here's the story of the river as it was told to me in one of my first public health classes. There's a river and several people swimming downstream, several people fishing downstream, rather. Suddenly, a woman comes floating down the river, struggling for her life. The fisher folk pull her out of the river. Then another person comes floating down and again must be rescued. This happens all afternoon until the fisher folk are tired from constantly pulling people out of the water. Two of the fisher folk look up and see a stream of people coming down the water, drowning. They think to themselves, we really need to go further upstream to see what's going on. When they move upstream, they notice that people are drawn to the river to look at it, but there's no safe way to do so, and so people fall in. Many people fall in. They report the number of people that have fallen and why to the community leaders, and the community leaders end up constructing a protective barrier next to the river upstream. Some people still fall in, but there are now far fewer victims to rescue downstream. This story tells us two things. One, public health has a morbid sense of humor. And two, moving upstream means focusing on prevention, a primary tenet of public health. Let's take housing. We may assume that lack of affordable housing options is why people are homeless. But what if further upstream we realize that medical expenses is what led a group of people to become homeless? Or that lack of access to adequate health care led to struggles to maintain an income? Or that structural inequities or stigma in the workplace led to people being let go instead of receiving support. We could channel all the money and energy in the world to pulling people out of the river downstream, building affordable homes, creating some jobs. But if we don't collectively spend time to figure out why these people fell into these problems upstream in the first place, our limited resources are ineffective downstream. And that can be hard. As we know in public health, prevention isn't sexy. It's hard to measure and therefore hard to fund, even though it saves money in the long run. I mean, how do you measure the number of people who did not develop diabetes or who did not fall into poverty? In my case, working with urban planners and builders to redesign neighborhoods was the upstream solution to addressing obesity and diabetes. Creating affordable nutrition or fitness classes would have been more of a downstream solution, necessary but not sufficient to prevent the epidemic. Moving upstream is exciting because it means big, audacious social change. It means shifting norms. Moving upstream means learning that investing in girls' education is the way to reduce global poverty. Moving upstream means realizing that structural racism might be the real barrier to you or me accessing care rather than our distance from the nearest hospital. So think about your issue and ask yourself, do you know what's upstream? Maybe it's time to find out. Sometimes we are so quick to want to find solutions, we forget to spend enough time understanding the problem from all angles. Social innovation as an undefined general concept has been part of many sociological disciplines for a number of decades. Over the last 2 decades or so, however, social innovation term and concept has become closely aligned with the business world. Borrowing from business innovation, social innovation now exists to solve pressing societal challenges that could perhaps use some rapid disruption. The general underpinning is a problem-solution framework that is common in business. But in order to be able to move upstream and pause on our problems a bit more, we need a different framework. And so my second public health lesson for you all today is change the framework, modify the problem-solution framework. And since I'm claiming that public health practitioners were some of the original social innovators, I've adopted a problem-solution framework from public health for social innovation. And that is the addition of cause and consequence. Problem identification is still step one. Step two now asks us to be curious about the cause, using cause in its broadest sense, the 20% and the 80%. It asks us to adopt an upstream prevention focus to studying the problem. Step three asks what can be done about the problem, but step four now asks us what works and how best to do it. To examine the evidence and study the science behind implementation. It forces us to realize that social solutions are delivered to people and therefore have consequences. It encourages us to be more bottom-up in our approaches to finding solutions for communities rather than for communities. Without this extra step, our rapid solutions could be irrelevant to the people that they serve at best and downright harmful at worst. As an example, one consequence of creating opportunities for income generation among many parts of the world has been a drastic increase in domestic violence. So as we examine, we may uncover problems that we've created or that have surfaced that lead us right back down this cycle again. Let's go through an example. Heard of the immunity charm. Afghanistan has typically had low children getting their immunization. It also has one of the world's worst rates of infant mortality. So for solutions, we may think about mobile reminders or mobile clinics to increase access, or maybe even a peer-to-peer implementation model for vaccine delivery. The consequence? Problem still not solved, children not getting immunized, and wasted resources. But if we move upstream some more and build voice within the community, we may learn that culture and a confusion about Western medicine may have more to do with children not getting immunized than anything else. The immunity charm built upon a talismanic tradition of bracelets that ward off evil spirits to create a beaded bracelet with each bead representing an immunization the child needed to get. A full immunity charm with all the beads now being sought after as a symbol of pride and safety for their children. Change the framework. Social innovation needs much more rigor than business innovation because it's often addressing the needs of vulnerable populations who are left out of the discussions that most impact them. All of this requires collaboration, which brings me to my third public health lesson. Work the system together. Systems change is a fundamental tenet of public health because no solution alone will improve the health of populations. And systems change is often represented as this house. Inside the house are three fundamental factors necessary to mitigate any issue: prevent the bad, promote the good, address the barriers, such as disparities in access. An easy way to remember that, at least for the women in the audience, think of this. For a happy home, you need to get a regular PAP. Prevent, address, promote. Outside the house, you need supportive policies and supportive environments to keep the house standing. So think about your issue in the context of this house. Who else is inside the house? Who else is working to prevent, address, or promote? Are the people most in need able to access your intervention? What type of environmental supports do you need to ensure people don't return to prison or return to homelessness? How do you join forces? Work the system. Identify your allies and those with whom you still need to create buy-in. In my case, we decided to commission a systems map of obesity to really understand and identify our allies. We wanted to know who our supporters would be, who could we partner with for greater effectiveness, who might save money with a change. We looked at everything: food consumption, production, physical activity, behavior, psychology, environment, etc. And the answer to all of our questions? This really easy map. More like noodle soup, as we affectionately called it. We kept the map pinned to our desks to remind us of the big picture, but also to terrify us into action. I don't recommend fear as a good tactic for action. What it did result in, though, was realizing that urban planners and transportation engineers were already aligned with our goals, and that for builders, maybe we needed to convince them by cost sharing on some pilot projects. What can be a good catalyst for action is realizing that we're all motivated by wanting to create meaningful change. I started this talk by showing you that health was related to things like income, education, poverty, homelessness, and I've hopefully convinced you that everything we're all working on together is linked. So we need to come together to solve it. I'm not working in health. You're not working in education. We are all working for society. All of our collective effort is to create healthy people in the biggest and truest sense of that word. This is why we are all public health practitioners. And as public health practitioners, I encourage you and challenge you to adopt this mindset and remember these three words: upstream, consequence, and system. Every single one of us has the power to spark big, lasting change by asking ourselves, what's more upstream? And by grounding ourselves in the evidence and going out beyond our comfort zone to speak to someone we never have. Maybe then, less of the same, but create more life-changing solutions. So social innovators, wear your public health badge with pride, because together we have the power to spark meaningful change that can create healthy systems and healthier populations. Thank you.